We're so excited to have everybody join us today for this wonderful webinar with Cape Fear Valley Health in Fayetteville, North Carolina. My name is Beth Vanderwalker. I'm the Vice President of Operations of WorldWide HealthStaff, and I have just some amazing people joining me today, and I'm really excited for you to meet them. First, we have Pat Blue. We also have Mary Beth Pilone. They are both with Cape Fear Valley Health. We also have Harold Maala, who is one of our international nurses that is placed at Cape Fear Valley Health and has been an amazing nurse there. We're super excited to have him join us. We have Amanda Shuttlesworth with us, and she is our senior case manager for our team and all of our nurses that are going to Cape Fear. And so just a great lineup today. I want to say Happy Nurses Week to everybody, and also Happy International Nurses Week to everyone. As we're moving into those great events, and nurses are greatly appreciated.
I'm in a web.
We have many people joining our chat today. What we'd love to see is in the chat box, let us know where you're tuning in from. Share with us where your country is, and we're super excited to have you here. Also, if you've already signed an agreement to join Cape Fear, let us know, because we want you to ask lots of questions today. We want to be able to answer all of your questions that you have today and just make this a great conversation. So, Mary Beth, I'll start with you. How are you doing this morning?
I'm well, thank you. Looking forward to chatting with everyone.
Well, we are as well. We have been partners with Cape Fear Valley Health for many years, and it has been an honor. We've gotten to travel abroad with Cape Fear, and we hope to one day do that again. But as always, Cape Fear is hiring a great group of nurses. Everyone's going to get ready to hear from you. We'll let you run the PowerPoint. But if you are online with us and you would like to chat directly with a recruiter, learn more about the opportunities with Cape Fear, feel free to click the link at the top of the chat button. Live recruiters are standing by. They can answer so many of your questions, which would be excellent. So Mary Beth, we'll let you share with us a little more about Cape Fear.
Yeah, I'm excited to talk to everyone about it. So I'm Mary Beth. I'm the Corporate Director of Talent Acquisition here at Cape Fear Valley. I myself have been with Cape Fear Valley for almost 2 years, and I relocated from out of state within the U.S. To join Cape Fear Valley's wonderful team. So I'm excited to share a little bit about us with you. Cape Fear Valley has 8 hospitals, which really equates to about 7,500 skilled professionals, and 1,000 of those plus physicians, with one main focus, which is our patient experience. So as you can see, we have a number of facilities, with our largest facility right at the top there being Cape Fear Valley Medical Center. So that medical center is by far and large the biggest of them all. So in that facility, we have 596 beds and are continuing to grow. Actually, in the next 2 years or so, we have a new tower being built, which will add an additional 100 beds to that medical center. So that's really something wonderful that we're super excited about and getting that going. So Cape Fear Valley was established in 1956, and we actually do span over about 9 counties within North Carolina. So we are continuing to grow by the day. Those are just a few pictures of our different facilities, and you can see our helicopter. Helicopter typically lands right on the lawn in the front of the hospital, which is always something really exciting for people to see. And if you're standing too nearby, if you're standing too nearby, you might be blown away. But it's something really cool to see, and direct patient access care to the main facility. So some of the really exciting certifications and accreditations that we have are listed below, but more specifically, some of the disease-specific certifications as certified by the Joint Commission we're certified in. So heart attack care, heart failure, stroke, pneumonia, hip replacement, knee replacement, sepsis, perinatal care. At some of our more small facilities like Highsmith, Rainey, Hoke, and Bladen, they too have some specialty certifications approved by the Joint Commission. So wound care, respiratory failure, acute stroke, chest pain, hip replacement, knee, pneumonia, and sepsis. So we're really excited that that does span system wide. Further, you can go ahead and see some of the other accreditations for quality and safety that we have as well. So, cancer care, chest pain, breast care, weight loss surgery, physical rehabilitation, sleep medicine, geriatric ED. So the list there is quite plentiful. In addition to that, we do fully oversee the emergency medical services for Cumberland County as well, providing all of the paramedics and ambulance services across the county. A really cool thing that we're excited about is we are ranked one of the best hospitals in North Carolina in 16, 17, 18, 19, and 2021. So something that we are super proud of. One of the, I would say, best things, and Pat can probably speak to this much, much more fluently than I can, is the opportunity for all nurses who are bedside to really participate in our clinical ladder program. So, our clinical ladder program really consists of 4 levels. Participation is voluntary, it's not mandatory, and really it provides our nurses with advancement and achievement opportunities to really expand their skills, to provide better patient care to our patients, and just all around being more invested in the nursing culture at Cape Fear Valley. So, again, it speaks to the professional growth, expertise, and really allows the nurse who's involved in the clinical ladder to create a portfolio for themselves, really just showcasing all the interesting things that they've done. So a couple of those subsets really involved are professional development, organizational engagement, such as sitting on committees or nursing committees, contributions to nursing, such as teaching a basic life support class or something of that sort. And community involvement as well, because we are the people that take care of the people within our community. So that's something that's very important for us. Pat, do you have anything to add to the clinical ladder program or anything maybe that you've seen?
It's really exciting to see our nurses, we call it leveling up. It gives the nurse the professional recognition within the unit itself. And what we've seen is that each nurse, when a nurse on a unit gets that clinical ladder, they're able to reach and help another nurse obtain that same level of professional growth and recognition. And it's really exciting. We make a big deal. We go on the unit and we get everybody excited about this an individual nurse's professional growth and expertise, and it's really exciting to see. Yeah.
I love it. And then a big part of that for me as well is not only does the clinical ladder come with professional growth and advancement and all of that, it also comes with additional compensation. And who doesn't love additional compensation? So,
Absolutely.
True.
very true. And so with that, the financial benefits, and you can kind of see what's required there to hit each level or advancement within the clinical ladder. It shows that you have to have a specific degree or certification, the years in terms of nursing experience that you need, along with the number of activities. And we had discussed those a little bit a while ago, talking about whether it's training in the BLS, doing something in the community and involving yourself. So all of those would count as activities that would be counted towards the increase in the level of advancement. The financial benefits, which I think are very, very interesting and very, very cool, are actually stacked. And what I mean by that is if you come in as a nurse one or a staff RN one, which is what we call it, if you hit your clinical ladder level 2, you would get a 5% rate increase to your base pay rate, which is your hourly rate. In addition to that, if you hit your level 3, we would stack on another 6.5%. So at this point, you're at 11.5% increase. If you then move forward to a level 4, which we absolutely love for both the nurse and the organization in terms of patient experience, you would at that point achieve a 7.5 additional hourly increase. So being candid in that, some of the organizations that I've seen do only give you 5%, and then your next percent might be 1.5 or 2.5. Our organization actually stacks those financial components on fully so that you would get the full sum of that, which is really exciting.
You know, Mary Beth, I will add to that, like, what a generous program. I've worked for hospitals. I've worked with a lot of hospitals. Not everybody's doing such a generous program. And I hope that's, I know it must resonate with the nurses and an exciting way to continue to grow professionally.
Right.
Yeah. It's something that's very interesting, and people get very, very excited about. At that level, I think the more you move up, the larger your voice within our nursing organization actually is. And so having that involvement and excitedness around it is it's really imperative. So that is pretty much all I've got. I hope you've learned a little bit more about Cape Fear Valley from the presentation.
No, I think that is wonderful. Let me ask you a question. To move up to different levels, what would be some of those things that a nurse would do to move up between levels? Do you have any examples of maybe one or two things?
So
Go ahead, Pat.
I do. So for our in the ICUs, we have several committees within the ICUs, and one of them is the CAUTI prevention. That's where we prevent urinary tract infections as a result of having an indwelling Foley. And so our nurses did a whole one of our nurses did a whole evidence-based presentation to the nursing staff to say, this is how we're going to decrease our CARDI rate. And that was a presentation, and actually it helped us decrease our CARDI rate. Another nurse, she took on, in our observation unit, she took on, actually, I'll talk about Harold's unit. One of the nurses did a presentation where we looked at our process of involuntarily committing patients. And so that whole process has to go through the legal system, and it involves many other areas. And one of the nurses, she streamlined that whole process to say, this is how we're going to do it. And Harold's unit is leading the whole facility in compliance, and all the units within the hospital, they call Harold's unit to say, can you help me with this? And it's that level of expertise that the nurses, the ones who are actually doing the work, bring to the table to say, hey, this is how we should be doing it. And it actually makes it easier for the nurse to be compliant and deliver evidence-based care. Yeah.
Well, that is excellent. I mean, any hospital that knows and recognizes their nurse as an expert wants them to be actively involved. And then all of those results can be tracked back to the work that they're doing. So I do want everyone to meet Pat Blue a little more. Pat, how long, tell us what department you're the director of and how long you've been with Cape Fear.
So good morning again, everybody. I'm Pat Blue. I'm the Corporate Critical Care Service Line Director. I am homegrown. I have been with the facility about 25 years. And I do new nurse orientation. And I often tell our new nurses that this is the best journey ever. Cape Fear Valley has made an investment into my professional growth, and I have been able to advance in many levels here at Cape Fear Valley. And so, yeah.
And if you were a part of our recruiting event in Dubai in 2019, you would have met Pat, and me and Pat were overseas getting to meet so many of the amazing nurses that have since joined and have started at Cape Fear. I'm going to introduce Amanda Williams, and she's getting to have a conversation with Harold as well.
Yeah, thank you, Beth. Again, we're really excited to have Harold Maala on the call today, and we're just going to kind of let Harold kind of give his, personal insight and testimony on his whole experience. So, Harold, if you could just kind of tell everybody who's listening in live, what do you love about working at Cape Fear?
Hi, everyone. Good morning. So I'm Harold. I'm working as a staff nurse in 2 North. It's a medical psych unit in Cape Fear Valley Hospital. I was really excited when they were actually talking about Miss Pat and Miss Mary Beth about the clinical ladder because I also applied for a clinical ladder. I just finished my portfolio.
Yay!
Yes, ma'am. I'm planning to
That's
submit it
amazing.
by this June because working at Cape Fear Valley, I find the support of everyone I get to work with, especially with my manager, my preceptor, and my coworker. Initially thinking of working to another country, you get to be anxious, like starting another career in another country in a new facility, and especially me having to work in another country, like because I used to work in Abu Dhabi. I was hired from Abu Dhabi. And I was working before in like an observation clinic, and I was lucky enough to get hired by Cape Fear Valley Hospital through the help of WWHS to be working in an inpatient unit, which is the med psych floor wherein I am at. I find that the support of everyone is really helpful. Actually, my manager, Miss Tasha, and all my preceptors and my charge nurses are the one who pushed me to apply for a clinical ladder, and it's really amazing the experience, like getting involved in the facility itself and like sharing your own knowledge, not only sharing your own knowledge but also gaining some of the knowledges from some of the knowledge from other nurses as well. It has been a wonderful experience. Actually, the people are very warm and friendly, very, I can say that they're very, very supportive. I'm lucky enough to be in my unit. Yes.
Awesome. Thank you, Harold. So speaking of your unit, if you want to kind of share what's like a typical day for you when you're working at Cape Fear in your unit.
So a typical day for me is I am working as a night shift nurse. So when the day starts for me at around 5 p.m. I get to prepare, and then I live just across Cape Fear Valley because there's this village like subdivision here where you can rent that is nearby the hospital. So I chose that one because as of now I still don't know how to drive. That's why I'm so lucky that I get to find like a place near the hospital. So I work, I walk going to the hospital, and when I go to the hospital, I just check out the board and see whom are the patients I will be handling. And then once I get in, we do our briefly reports just to see any updates about the patient. We meet with our charge nurse and all the other nurses that we will be working with. They try to explain about the newly admitted patients, what are the population of the patients. Since I'm also working in a behavioral unit, they are trying to explain us any safety concerns about any patients. How should we deal with this different type of patients? So after receiving those reports and receiving your designated patients for the shift, we start to walk around the unit, receive directly the endorsement from the outgoing nurse, and then after that, do your introductions with the patients, and then as you go along, you do your assessments as well. So what I do is just like ask them how did their day went, not only observing like the physical aspect, but mostly observing also the nonverbal cues that the patient is having, since it is a behavioral unit. So after that, like prepare your medications, after you do your physical assessments, and then review anything that has transpired throughout the day, whether are there any updates from the physician, from the family of the patients, what needs to be done, and then prepare your care plan, your nursing interventions along, and then work your way throughout the night, and then have them get settled. What we usually do in our unit is we also have a huddle, Like if we have time and we're not that kind of busy, we communicate what has been going with our patients to our charge nurse, so that she is updated as well. And then what we can work on for our patients, like if this patient needs an adjustment for their medications, what would help them like get a better sleep, or help them like in their behaviors that they're presenting, because sometimes it's not really visible. Like once you see a patient, you cannot see directly what's running in their minds. So after that, we just prepare, do our bedside care as well, and then prepare for the morning shift that's coming. So that's mostly it. But every day is different. So
That is true.
that's
Thank
mostly
you, Harold, for sharing.
Yes.
And everybody joining live, Harold actually just came off of a 12-hour shift, and he was
Yes.
It
to
is.
hop on the webinar and share his experience with everybody.
It has
I
been
know.
busy, but it's very fulfilling, I can tell you. Because, I'd also like to share that it's my first time to be in a psych unit. I was really anxious at first. Like, I don't know what to expect. But meeting with my manager and the preceptor, they get Keep Your Value also helped me. They signed me up to do some trainings like the non-crisis intervention, so that I do know what to do when situations arise, like in the floor. Yes.
So if I may add to what Harold is saying, one of the things that we pride ourselves on here at Cape Fear Valley is that we have our managers to meet with each employee, if not on a monthly basis, then
Yes.
every other month, just to make sure that we're maintaining a connection. And just our nurses are more than just nurses. They have a life outside of Cape Fear Valley. And we want to make sure that we are attending to the whole nurse, if you will. But it is important that we acknowledge the nurse as not only a nurse, as a mother, a father, a sister. They are important. And so what is going on outside of the hospital, just to make sure that you're getting enough rest, you're getting your vacation time. It's important that our managers get a maintain a connection. But even while our nurses are on orientation, we have our managers and preceptors to make sure that we have documented weekly meetings, just to make sure that we are making sure that our nurses are prepared when they are off orientation. Typically, our orientation time is anywhere from 5 to 6 weeks. It may be more if the nurse should need it. However, we want to make sure that our nurses are prepared when they're off orientation. And the only way that we can do that is that we maintain a close connection and communication with our nurses.
Pat, I love that, because since COVID, I think so many nurses have experienced such a burnout rate, and making sure that people have that time to have that personal life outside is such an important part. Harold, let me ask you about that. What's it like living in Fayetteville, North Carolina?
It is very nice, actually. I enjoy the weather here, though sometimes it's unpredictable, but it's not unlike any other countries where we're in, like it's like snowing every time. But here you get to experience like the sunny weather, and you get to also explore because you're within reach with the beach. It's just near the beach. It's also near the mountain, so you can go climbing and all that kind of stuff. Yes. And what I also enjoy here in Fayetteville is that there are a lot of Filipino nurses here in Fayetteville. Yes. I was so surprised. I thought like it's gonna be a different country for me. I mean a different location for me, and there's like no other Filipino I can meet. But I was so surprised and happy that I saw when I do the ocular survey of the hospital. I get to meet other Filipino nurses working in the hospital as well. And it's really fun, actually. I love North Carolina. I'm not saying it just because I'm staying here, but I do like it here. It's just like slow paced. It's not like that busy enough. But
Mhm.
yeah, you just get to enjoy,
Yeah,
especially
North
when you're off.
Carolina
Yeah.
has beautiful weather. It has multiple
Mm-hmm.
seasons. Like you said, it is very close to the beach, the Atlantic Ocean. So many
Yes.
perks in that area. It is beautiful. So that's wonderful. We did have a question. We've had a couple questions come in for you. One of the questions that we had is, what's the difference between working in the United States as compared to the Philippines?
Very good question.
It's very different because when I was working before, because I have been working in the Philippines from 2010 to 2015. So it's like a long time already. When we were working there, it's like the documentation, we have to write it. Everything we have to document through
Mhm.
writing. But here we have a system like the, what do you call this?
Epic.
The
Epic.
Epic. Yes, the
Mhm.
Mhm.
Epic. And also the medication dispensing. You have to pick it up. I don't know if it has changed since then, but back when I was working in the Philippines, you have to pick up all the medications for all your patients. So
Mhm.
it's like time wasting. But here you have the Pixis also, so you can easily prepare all the medications. It has been prepared for you. And so there can be it can help you as well, like to deliver a safe I mean safe
Safe patient care.
yes safe patient
Yeah.
care, yes,
Yeah,
safe
that's
patient care
wonderful.
to the patient, yes.
So let me ask you about this. For many nurses that have not done computer charting
Mm-hmm.
previously, but now they will be doing that at Cape Fear, do you feel like you got the training and education to feel confident doing computer charting?
Yes, definitely. As what Miss Pat mentioned earlier, we have a 6 weeks intensive training for that. We get to have like 2 weeks, I believe, for no 1 week, but then they extended it now for 2 weeks, I believe, from
Right.
what I heard from my friends coming in to do the training. So they're more particular with the documentation and everything. They have to do their assessments as well. Like I don't know if what's it called, like a revalida when I was back in college, like a return demonstration, just to make
Mhm.
sure that
Yes.
you have acquired all the knowledge that they have taught you,
Yes.
just to gauge whether you've learned everything that they have taught you and you are applying it in a safe and like proper way.
No. I do love those. All those systems are in place to support the patient and support
Yeah,
the nurse and
yeah.
to make the nurse's job easier throughout the day because we already have so many demands on us. Another question that's come in for you, Harold, is how long had you been at Cape Fear before you applied for the ladder program?
I applied for the ladder program December, I believe, because it's just that the COVID is still there. That's why sometimes it's taking time for me to complete all the documents necessary.
Mhm.
But I joined Cape Fear August last year, and I have complete my portfolio last April, but I just didn't meet the deadline. That's why it took me another month for me to submit the portfolio.
Well, and listen, one of the
Mhm.
things that I know for many of our Philippine nurses is that you have to allow yourself time to get transitioned and comfortable in your new environment and get through your orientation. But Pat, I'll ask you a little bit more. We've had some more questions on the ladder program. Is there a requirement that you have to be there so long before you can apply? And is it a hospital sponsored program?
It is a hospital sponsored program. However, you don't have to be at the facility a certain amount of time. If the requirement is that you have, I think it's 6 months or maybe a year of experience, nursing experience. You can come with that year of experience and then apply. Your project has to be approved by your manager, but most of our managers they welcome the opportunity to get more clinical nurse ladder nurses on their unit because they bring a wealth of experience. They're doing projects that are benefits to the nursing unit itself, and ultimately our patients will benefit from it. So, yeah.
Yeah, excellent program, excellent opportunities. So that is just a great thing on that one. Let's talk about some of the questions that we regularly get on how to be able to join Cape Fear. And so I can speak a little bit about our recruiting process, share all the details around our recruiting process. And then I'm going to let Amanda share with everybody what to expect in the case manager process. And we can answer questions around that. If you are interested in joining Cape Fear, we have a link above where you can chat with one of our live recruiters. You can also click on our link, recruiter, or you can send in your resume or your CV at recruiter@healthstaff.org. And one of our team members will reach out to you. They pre-screen every resume that's coming in. For our nurses in Cape Fear, you will have had to pass the NCLEX exam, which is a U.S.-based exam to be able to work in the United States. That's your main qualification. We also look for 2 years of experience as a nurse working in an acute care facility. We will then, our recruiters will set up an interview via web chat like this, where you can actually be interviewed by one of the leadership team members with Cape Fear. It's a great interview. They're friendly, they're welcoming. What they're asking is just to learn about your experience and why you want to come to the United States to work. We want to make sure it's a great fit for you.
Right.
Once you've completed your interview, your WorldWide HealthStaff team works with your Cape Fear team. They decide who will be getting a job offer. Once that job offer is ready to go, we're going to send that to you in an electronic format through DocuSign, where you can review that document and sign it electronically. And we encourage you to take at least up to 3 days, if you need that long, to review the contract, know what the expectations are, what you're responsible for. If you have any questions around the contract, our recruiters are there, which is excellent. We want to make sure that you go into this opportunity with all the knowledge you need to make some great decisions. From that point, once you sign your agreement, then you get moved over to a team of wonderful case managers, and they're going to help you through that immigration process. And Amanda, do you want to share a little bit about that?
Yeah, absolutely. Thank you, Beth. Yeah, so I really love being on these webinars. Case management gets to work directly with all of the nurses and assist them throughout the entire immigration process once they sign their offer. It's really wonderful to see some of my nurses in the chat who I've worked with. So thank you for joining to you guys with the case management team. We are just here for your full support throughout the whole process. We've laid out the immigration process in a really great 13-step program. And we're here to support the nurses throughout the entire process. We're here to answer all questions. We are kind of for you as the nurse, we're your support system to communicate with the attorneys, to communicate with Cape Fear, help address any of your concerns, and guide you through the immigration process. We have a lot of wonderful resources to assist you. I would like to kind of reach out to Harold, and if you want to give a little insight as well on, your journey with your case management team, what was some of, the easiest parts of the immigration process, so some of the hardest parts of the immigration process.
The hardest part, I'll start with the easiest part. I think what I can share about that is that my advice to all those who are trying to apply for a job here in the United States is that to have their credentials on the ready. Because what worked for me is because when I tried to apply at WWHS for a position as a staff nurse, I already got my documents with me. So I already passed my IELTS. And not only that, I also have my NCLEX with me. So while working on it, I also was working on my visa screening. So it's like working all together. That's why my application was like only, my hiring process was like for about a year only, because I passed my NCLEX exam 2020 Feb, and then I was hired by WWHS by March because I got all my documents already. The movement of my application is very fast. It's just that it took some time because of the pandemic, but now since starting to get better, so I believe that the movement of all the processing will be fast now. I also would like to acknowledge all the case managers that I dealt with during my application, because they're really responsive. Because what I can also advise to those who are interested is to never be afraid to ask questions, because with me, I always communicate with my nurse manager what is the next step. Not only that, they're answering all my questions. They are providing me the like a roadmap on what should be done next, what you should have prepared, so that we can have a smooth transition from that. So it has been, all in all, it's been easy for me actually. But I believe that some of my fellow nurses who are back in the Philippines have some troubles with that. But what I would like to tell them is just to have all their credentials on the ready.
Yeah.
Mm-hmm.
Now, I will add to that. One of the
Thank you, Carol.
biggest
That's really great advice.
Yeah, I was going to add, one of the questions that we get a lot is how can I speed up my immigration process? And that's Harold, really answered that, is that if you're looking to go through this process as fast as possible, when you receive your roadmap, think of all of the documents that you're required to submit. Have those ready, get those submitted as quickly as possible. A lot of times the delays that we have is as we're waiting for the nurses to send the documents.
Mm-hmm. That is true.
We have had nurses send 100% of their documents that they have in the early stages. That way, as soon as the next stage comes available, our case managers have everything they need to go ahead and submit those documents to the attorney. So having those ready, we send you a list of 100% of the documents that you will need. You can begin working on that very early. The other wonderful thing is that Cape Fear Valley Health pays for premium processing.
Yes.
For all of their nurses.
That is so true. Mm-hmm.
And that's a really big deal. And what I will share with you, when we submit a I-140 petition with premium processing, you normally will have your priority date within about 2 weeks. Without that, Amanda, I think, gosh, it's been taken up to 2 and 3 months sometimes. So we're cutting time off all throughout the process as fast as we can. Amanda, what other suggestions do you have that can help nurses be successful through the case management process?
Yeah, I think too, to build off of what Harold said, with asking questions. I think that's the biggest thing. Reach out to your case manager if you have any question at all. We're here to support you. In terms of being prepared for document collection, we will always be able to provide you, the next steps or the future steps, and let you know, what are the civil documents that we'll be collecting from you in maybe a couple weeks, so you can go ahead and start getting prepared. Those are really great tips to get your petition moving quickly. But yeah, I think just always inquiring with your case managers. If you have questions, we have a lot of resources on our end. We have a great licensure team. If you have licensure questions, we're right across the hallway from our attorney, so we can always consult with them about things. Just never be scared to reach out to your case manager and ask them a question, because that's what we're here for, and we want to support you. We know it's a really, really big journey for you guys, and it can be stressful and it can be exciting, and we just want to be there to support you. So I think that's the greatest tip, is to reach out to your case manager, and they'll always be there to support you and answer questions. And I will say, sometimes your case manager maybe has to reach out to someone else and get an answer. We're always learning. Things are always changing. We're adapting to the way that the government's working, with the pandemic playing out, and the way the embassies are processing petitions and things like that. We're always looking to, increase our knowledge and inform the nurses as well.
Thank you. That's excellent. The other thing that your case manager is going to ask for is an updated resume, even after you've signed, every 6 months. And one of the reasons we do that is to make sure that you're still actively working in your field, that you're getting your clinical hours, because what we want is that when you arrive to Cape Fear, you can be very successful and you have that hands-on practical nursing, that you're in there working, and you haven't had long delays in your skill set. And so you'll be able to expect that. The last stage of the process is our relocation process. And we have a wonderful travel relocation team. We do all of your booking for your flight after you've passed your embassy interview. We'll book your flight. We book your transportation. We make sure that you have some initial housing when you arrive to Fayetteville. We have many resources to help you find apartments. This is direct hire, so you get to choose where you live, and this becomes your new home for you. In your we have a support guide with many vendors that you can access their resources, including car availability, driving lessons, apartment help, continuing education. How was that experience for you, Harold?
That is so true, ma'am. Because actually, I was reading all of my previous emails from my case manager, and I was really uh, laughing because even the resources like for the housing, they have provided it to me because I was like communicating with the manager that my flight is close to the my flight is not yet close to the turnover of the apartment. So what can I do for this? And then she sent me all these details like, if you want, you can try and check out these places. We have other resources that we can offer you. Yes, I believe also for the car rentals, like the transportation that you need to use in going to your work, they also provided as well. But I just don't have the time to practice yet my driving. So I still haven't gotten on that part.
It will come. We don't want you to practice by yourself.
Yes,
Night shifts.
but I was so glad that they have offered like an apartment very close to the hospital. So
Yeah. If I may, one of the nurses assistants on Harold's unit, she has been offering some of the nurses driving lessons and to help them
oh,
get their driver's license. She has been Yvette Harold. She has
oh really?
yes, yes.
I will ask Yvette then.
Yeah, I love that. For anyone that's interested, one of the things that we have is an arrival to the USA guide. And in that guide, we try to answer, we have gathered questions from all of our nurses from over the years on just common things that come up about American culture and the healthcare system and the schooling system and how to enroll their kids in school and how to take extra classes and even continue your career. And so you will get all of those resources. Those are free resources that we provide to all of our nurses. Pat, let me ask you a question. This is a question that has come up, is that during the preceptorship, the training, the computer training, is all of that paid during that time, or is that on the nurse's time?
No, all of that is paid time.
It is, yes.
Yes, that is all paid time. Yeah, our goal is we have gotten some excellent nurses through Worldwide. Our goal is not necessarily to teach the candidate how to be a nurse. Is to teach them how to do nursing Cape Fear Valley way, and again, that is all based on evidence-based care. Again, we have gotten excellent nurses through Worldwide.
Yeah. And that's why you guys have been named one of the top hospitals in North Carolina. And as a nurse, if I'm going to team with the facility, I want to make sure that it has all of the support and the care, and not just for the patients, but for the nurses as well, to make sure they're supported. And as people are looking at new hospitals, new opportunities in the United States, that's one of the things I would really encourage you to do is make sure that, you know, not only are they going to offer you a good competitive salary, but that once you get there, that you're going to be well taken care of. You're going to have a support team. You're going to have cultural support with other Filipino nurses, if that's what you're looking for. And that it can be a place where you can call it home for several years. And we hope you'll be like Pat, that you'll be there for 30, 40, 50 years.
Yeah.
Because it's a great place to work. So I know we've had so many other questions come in. I'm going to introduce you guys to our marketing team, and what questions can we help answer? Feel free to continue to fill up our Q&A box with lots of questions that you might have. We're going to address them. We want to give you all the information that you need. And then if you don't feel comfortable openly chatting like that, feel free to hit our link. It's pinned at the top. We have a live recruiter that would love to speak to you and answer your individual questions as well. So Tracy, I'm going to turn some time over to you. Oh, and we can't hear you.
Yeah.
There you
Sorry.
go.
Thanks, Beth, and thanks, everybody. Yeah. Hi, I'm Tracy, and over here is CJ. So we're up with the marketing team here at WorldWide HealthStaff Solutions, and we just want to pull just a few questions from the chat and ask our awesome panel here. And we're going to go ahead and pull a few of these questions, and CJ here is going to pose them to, well, whoever's best to answer it. CJ?
All right. So, hello, everyone. I'm CJ, and I'm the Applicant Engagement Manager at WorldWide HealthStaff Solutions. So, also, my wife is a worldwide nurse, and she's also working here in the U.S. And we are so lucky to have WWH as with us, because we really had a smooth process when it comes to transitioning here in the U.S. So, okay, so we will be the one to join you with our Q&A session. So we have a lot of questions here for our panel. So first one, what is the nurse to patient ratio on ICU and med surgical unit?
So the nurse patient ratio in the ICU is typically a 1 to 1 nurse to 2 patients. If the patient acuity is really high, with things like organ donation or CRRT or a balloon pump or things like the ECMO, it is a 1-to-1. On the med-surg areas, let me just say this, for the high density or the progressive care or step down units, that is a 3-to-1 or 4-to-1. For the med-surg, it is a 1-to-5 or a 1-to-6 ratio.
Yes.
Oh, and we've
Does
can't
that
hear you, CJ. No, I think that's a great question. There's also nurse aides that work on the floor that support the nurses as well. So you're going to have some extra support there as well.
Absolutely, yes.
All right, awesome. Okay, so next question is from Lorna. She's asking do we receive allowance or salary during the training period?
Mm-hmm. Yes, you do. All that is paid time.
Correct. So you would be paid from your first day here.
Okay, awesome. Nice. All right. Next one. What is the shift hours in L&D department? Is it 8-hour or a 12-hour shift?
That is a 12-hour shift.
12-hour shifts, yep.
Okay, awesome.
Is that true for most of your departments? Are they mostly 12-hour?
Most of our departments, yes, are 12 hours. Our emergency department, they have different shifts. They range from 8 to 10 to 12-hour shifts.
Okay, awesome. So since we are talking about the hours for the shift, here's a question from Boaz on Diki. So he said, is one allowed to do more than one shift a day?
We allow our nurses to do up to 16 hours a day. We want to make sure that you're well rested to deliver the best care possible. So there are times when our nurses are, they're asked to work extra over but we do not like for them to work more than 16 hours. Yeah. We want the nurse to be safe to deliver safe patient care. Yeah.
Okay, awesome. Another question. So, it says here, can one start his career as CNA in Cape Fear Valley? And how can one pursue his career in nursing in Cape Fear Valley?
So to be able to pursue your nursing career at Cape Fear Valley, 2 things I would suggest. Click on the link above. You'll get to speak to a recruiter. They'll be able to connect you there. Cape Fear Valley, one of the questions that we've had, has hired nurse aides in the past. So that's something that we may be seeing again. Right now, we have several hospital positions on multiple floors and units available. So please reach out to a recruiter, share with them your resume, share which area that you have an interest in. And if it's a great match, we will let you know. We'll get you set up with a Cape Fear Valley team member.
All right. Thank you so much for that answer. So, I'm just picking some questions here. All right.
One question that I saw that I thought was really interesting is if you have nursing experience in multiple countries, is that considered? And I will say, yes, it is. We look for 2 years of nursing experience, regardless of where you've done that work. And we think it's amazing when nurses have already worked abroad. They've already had that experience of going into a new country. So we would add up all of your work experience as a registered nurse to go into that 2 year period. Anything else you want to add to that, Pat?
No, actually, I think it makes the nurse more prepared. They're used to that whole transition process, and so that is we accept that wholeheartedly. Yes.
Mm-hmm. All right. Any other questions, CJ?
All right. So we will have our last question. And this is from Kenneth Wafula. The question is the ladder program available for nurse aides who are RNs from their countries of origin?
So if you're a nurse aide and you wanted to go through the ladder program, maybe you're just waiting to take your NCLEX exam, what would that look like for them?
So we do have, if you were to come in as a nurse aide, we do have a bridge program internally in-house where a nurse could be trained or a nurse aide could be trained in-house to become a nurse aide too. So that is a ladder opportunity within there as well. And in between, a nurse and a nurse aide one, we also have a licensed practical nurse
Right.
as well. But I have found that most go from an NA1 to an NA2, hopefully pass the NCLEX, and then go straight into a staff RN1.
Okay. Let me ask you about that. If we have a nurse aide that starts, normally with the immigration, they have to work as a nurse aide for a couple months. But then once they pass that NCLEX exam, they can move right into a nurse and move into the RN salary, the RN benefits, and the RN ladder program, correct?
Correct. That's right.
All right. Yeah. And that's, I think, one of the messages that I've really taken away from today's call is that there's such an encouragement to move up, to grow within the organization. You're going to be compensated for that. All the work that you do at Cape Valley is going to be compensated. You're not going to be asked to come in and train for free or work for free. If you work overtime hours, they normally have an overtime hour pay as well. Is that correct?
That is correct. Yes.
That is correct.
Yep. So many other just amazing benefits that are coming from Cape Fear. So as we kind of wrap up, let's have some closing statements and some closing ideas of what you would like to share with those attending today on our call. Mary Beth, let's start with you. What would you say to our international nurses that are looking to join with Cape Fear?
So I can tell you that I relocated here from several states away for the opportunity, and Cape Valley is very centered in their culture. And you will build a second family here. It's inevitable, and Pat's smiling as I say that because the culture here is absolutely phenomenal. And a lot of my colleagues, I consider them more like family than I do a colleague, because they truly care about you, just like Pat was saying, they care about the whole nurse. That is very true. I find that to be 100% true. And to Harold's point, I love the weather here. It's been a nice adjustment. And you're centrally located. And the one thing I have to tell you all, and this might be a little selfish on my part, I come from a very busy metropolitan area. So not having traffic has been
Yes.
just a phenomenal transition for me. I don't think I would ever go back to an overpopulated area at this point, because I've been spoiled with not having to sit in hours of traffic every day. So that there's an abundance of reasons to come here. But from the nursing perspective, I would say that a lot of our nursing leaders, such as Pat, such as some of our CNOs, have grown up here. And that is phenomenal and actually very rare to see. people stay that long within an organization. So yeah, that's all I've got.
I will share when you mentioned, having such a family environment and the support. That's one of the reasons that I love, I'm a nurse and I love the direct hire model as opposed to a staffing or a travel model, because you can set your roots down, you get to have that support system. In some of the other models, they can move you. You can fall in love with the location and feel like you're so belonging there, and that you could get moved and not have a say in that. And this allows you to build those relationships and be supportive and be a part of a great community. Thank you so much for that. Pat, any final words you'd like to share with us?
So I would, first of all, I would highly recommend WorldWide to any nurse abroad that wants to come over. But one of the best things about working at Cape Fear Valley, Mary Beth said it is a sense of community and family. And one of the things I forgot to share earlier is that we've had some of our nurses from WorldWide. They are now precepting other nurses coming in from abroad. And we specifically do that because they're able to share their experience, and they know some of the barriers or some of the areas of opportunity that the nurse may be experiencing that we may not readily recognize. And so we purposefully get them ready to precept. Who better than someone who has been through that experience than to precept? And so, and that's very deliberate. Again, we want to make this the best opportunity for the nurses coming in, not only to this country, but to our facility. We'll get a better nurse out of it. We'll get a more loyal nurse out of it, and it'll be a win for everybody.
Amazing. That makes me so happy. Thank you so much, Pat. And listen, we're going to end on a message from Harold, because he has done this. He's been through this process. I think his testimonial is one that is going to resonate with most of us. Harold, what would you like to share with everybody before we close out our webinar today?
I would also like to share what Miss Pat just mentioned, that I would highly recommend WWHS. That is really true, because as I was talking earlier with Miss, I forgot the name, Miss Beth Vanderwalker. Yes, because I remember when I just recently passed my NCLEX and I am desperate to go to the United States, I just messaged her and she's very responsive.
Yes.
So they're really gonna help you with your dreams, as what they did to me. And I also like to mention that working in Cape Fear Valley Hospital has been a very pleasant and wonderful experience to me, because not only do I get to train with many competent nurses, but most of all, very supportive, and they always want what's best for you. So yeah, you should go and apply. Yes, that is so true.
Thank you so much. That is greatly appreciated. So I will share, and with everybody joining us today, if you're interested in this opportunity, please email one of our recruiters. You can email them at recruiters@healthstaff.org. You can click on the link. We have Facebook, Instagram, a YouTube channel, Twitter, a lot of social medias. We want to be able to connect you. In the subject line of your resume, share that you're interested in Cape Fear Valley Health. We are hiring many positions. We're here to support you. We want to help you to start this amazing journey. We're going to make it as quick and as efficient as we can to help you reach your dreams. And it is an honor to be able to work in an organization that supports such a great cause. So thank you, everybody, for joining us today. We hope all of your answers were able, or your questions were able to be answered. If not, feel free to reach out again, and reach out to your case managers. If you've already signed on, stay in touch, ask lots of questions, and we're going to try to do the best we can to always support you in your dream. Have a wonderful night if you're abroad, or have a wonderful day here, and we look forward to hearing from you. Thank you so much.